There's definitely a lot of opinion pieces and some internal or external guidance that have been published, but to my knowledge, there was not clear guidelines telling us you should do this or that with this or that patient. The NCCN did say, about low risk, intermediate risk could be postponed, high risk cases potentially should get treatment sooner, but I wouldn't call that in the realm of clear guidelines supported by level 1 evidence or something like that. I think internally, we did come up at the Brigham and the Farber with some sort of guidance about how we would manage these patients and trying to be consistent among providers. I think that most of us could agree that most low risk and most intermediate risk prostate cancer patients can be safely postponed by 4 weeks, 8 weeks, 12 weeks. And I think that's what we did in the majority of cases. I guess the more tricky question is what we do with high-risk prostate cancer patients. I think in some instances we proceeded to treatment immediately as per usual, despite the risk of COVID-19, after counseling our patients carefully about the pros and cons of proceeding. But I think we also did creatively propose alternative plans. For example, putting some of these patients on neoadjuvant androgen deprivation therapy, either as part of a clinical trial such as Proteus, but even off trial to try to minimize the potential for spread of the disease while we're holding off on treatment due to the crisis.